What MGB is doing to you is something totally different. This we call it as functional restriction, not mechanical obstruction.
Yes.
Here, you are not tight from here, you're tight from here.
Well, yes, you still got to have a commitment.
You got a very easy control on your weight. You are the master of your weight.
Well, yes, because you're lacking the hunger element.
Yes.
That makes people,
Yes. The peptide YY,
Yeah.
it's a hormone which gives you satiety, satisfaction. That is what is playing the role. The reason is, not, you'll ask me, what's the reason? Why not in the Roux-en-Y? It's all, brand new research. Every day we are learning new things. But this is practical. As you have got it done, this is the difference. And we have other patients also where we have converted them from Roux-en-Y to MGB, and we clearly see this difference on the hunger element. What I would say is that MGB makes you a stronger man as far as the control of weight is concerned. You can control your weight like this. It's not that it puts a lock here. It can go up. It can go, you can gain 15-20 pounds like this. But the day you decide, I want to lose now, you can do that.
Well, yes, and it gives you confidence, because after the operation, because you cannot eat solid food for 2 or 3 months, you're just living on liquids. That gives you confidence. You say, well, I've done it in the past. I was able to live without solid food for 3 months.
The difference in Roux-en-Y and MGB, this food is being delivered here.
Yes.
This is the roux limb, which was actually inserted here to avoid the bile reflux. And as you know, bile reflux is not a significant thing.
No, everyone gets it at some stage.
Yeah, that's only once in a year or once in 6 months, and that too you can avoid if you do not eat immediately before going to bed, or you do not eat fried foods at night. But that's a little,
it's a little inconvenience compared to saving your life, really. If you've got full metabolic syndrome, all parts of your health,
HbA1c,
your liver, other organs, it takes over your whole life. High blood pressure, high cholesterol.
So all those things are
there's 1 or 2 tiny little drawbacks, but compared to metabolic syndrome,
that's what we think. That it's a good trade-off.
Oh yeah.
On one hand, you have
no pain, no gain.
Little chances of bile reflux, but on the other hand, you have a very safe surgery, very effective surgery.
And that can be avoided as long as you know about gastric health. For anyone,
you should know how to handle it.
They should know to that.
And the difference now, which we understand, this is the length of bypass in Roux-en-Y, because your bile starts from here and it reaches here, and this is the channel for the food. So here the food is mixing with the bile. So this is the length. This is about 70 centimeters. But if you see in MGB, the bile is traveling. This is the juice coming from the liver. It has to travel around 200 centimeters to reach the food. So we say this bypass is 200 centimeters in MGB, whereas in Roux-en-Y it is 70 centimeters.
So it's been a lot more chance to dilute the acid before it gets to any...
So basically the absorption is less in MGB. It's a more powerful bypass, and this is what we know from the data which has been published. The reports are coming from different countries now. Now we know that because of the longer bypass, MGB is stronger, but at the same time it gives you luxury to eat a moderate amount of food. So you can relish your food, you can enjoy your food, but the bypass is longer than Roux-en-Y. Roux-en-Y is primarily based on restriction. If you fail the restriction,
which you do after a couple of years,
which you do very easily.
You've only got the malabsorption part left to...
Yes, so now we understand that it has to be a combination of malabsorption and restriction. But restriction should not be too much. Too much restriction, patient will fail like this. Because you are not satisfied with the amount of food which you have eaten.
You remain a patient for the rest of your life, basically.
Yes, you will
Whereas this, I feel completely normal.
Now if you are eating with me, nobody can make out whether you have undergone a bariatric surgery or not. So basically this is what we see in other patients as well, and it was a good discussion with you, and you shared your experience.
Yeah, well, it's still a miracle. Every day I wake up and I find
Yeah,
it's
that's
just
what we
amazing.
tell our patients. Do not think that with MGB we have put a lock inside, but it gives you the power.
Yeah.
So
gives you
now
confidence to
easy maintenance.
determine your lifestyle.
Easy maintenance of lost weight, and you can eat a little bit of wrong things also because it is,
you know that it's just a few weeks time.
you
back to
can
normal.
easily control it. Yeah. So it's if you take a lot of oil or fat in the food, it will push out. You will see it floating on the toilet seat. How much fat now you notice coming out in the toilet?
Well, I don't make a habit of looking at my things, but yes.
You must have noticed sometimes. Yeah.
Yes.
It comes out.
Yes.
Yeah. If you take a fatty meal. Yeah. So any other issues you have? What about your vitamin D3 levels?
Well, they're always low because I come from a northern climate with very little sun.
Even before surgery they were low?
Well, it was never mentioned because it's only in recent years that vitamin D deficiency has become big business.
So 6 years
so
back,
yes, I do have to take supplements for most of the year because we very rarely see sun.
Yeah, what we see here in our Indian patients is the vitamin D3, almost every patient has low vitamin D3 because of the same reason that they don't get out in the sun.
And also they cover up. My endocrinologist in the Philippines says a lot of Filipinos have vitamin D deficiency, even though it's a tropical climate.
Yeah.
It's because they cover their body
That's the reason.
totally.
Yeah.
So in fact they're,
especially in females here, the females, they would cover their face also. They don't want to
obviously,
get out.
same as in India, to have a white skin.
Yeah,
is
they
to
like
be
the white skin. Yeah.
more beautiful, a higher class,
Yeah.
and so forth. Yeah.
So that's the reason why they have low vitamin D3. But after bariatric surgery, we have the data. Actually, vitamin D3 should go down because the absorption decreases. Calcium should go down. What we are practically seeing is, in majority of the patients, it's going up because the monitoring becomes better. We tell the patient again and again that you have to take calcium, you have to take yogurt, you have to take milk or skimmed milk. So patients are a little bit more careful about the vitamin D3 and calcium, and they become more mobile also.
Yes, they exercise
Earlier they were
more
sitting.
outside.
Yeah.
They're less conscious of their body, so often in the West they'll expose more skin.
Yeah, if you use your bones, only then they will extract calcium from the blood. If you do not use your bone, doesn't matter how much amount of calcium you are eating, it will not reach the bone unless the bone has a requirement. They need to do some exercise. So people start walking, they start going out to functions. So earlier they were restricted to their homes. So this makes
also, there's a certain amount of shame in being obese. They don't want to go out and mix with people. But when you lose the weight, confidence comes back. You're happy to go out more.
Good. So what about smoking? Do you do smoking?
Never smoked in my life, never drunk alcohol in my life, never done drugs in my life.
Good.
But
and you got
chocolate was my only sin.
Okay. So now you don't take it?
Well, chocolate, yes, I love chocolate still, even though you told me not to. But as I said, it's not a problem now.
No problem now, because you have the powerful MGB with you.
Yes,
you have the power inside
you
your
become a Maharaja of your own body.
Yes, the Maharaja of your own body. Yes. Very good lines. And this I actually learned from you, and I tell my patients that this is what MGB gives you. It makes you the Maharaja of your body. You can control your weight. You can become the master.
You're not a slave anymore.
You're not a slave of obesity. And this is the power you need to understand. Do not think that it has put a lock, you will keep on eating anything and still your weight will be low, but just easy maintenance it gives you. Yeah. Very good.
Okay,
thank you very much.
Thank you, doctor. Thank you for everything.